So in medicine, things are actually according like that, all right? So if a patient actually comes to the clinic with a heavy injury or whatever, okay, at the accident and emergency unit, the first thing you should do is actually what? The A, B, C, D, E, F of resuscitation, okay? You should always check if the patient needs any one of them. I'm not actually saying you must do them accordingly. I'm just trying to say, yeah, you still need to confirm if the patient actually needs any one of them. So in this lecture, we'll be talking about what A means. We'll be talking about what B means. We'll be talking about what C means. We're talking about what D means. Talking about what E means. Talking about what F means. Okay? And resuscitation is basically what you're trying to bring the person to the optimum level, or how will I put it? Okay, optimum condition, right? So, say, you see that here is a sequence of steps for resuscitation, and it's often go with the mnemonic word A B C D E F. Okay, so that's why they call it what A B C D E F of what resuscitation. So first of all, if a patient comes to the clinic, except you see the patient doing well, once they have lied the patient down, you should always check, okay, and check for the airways. And in the airways, what are you checking? You are accessing for the patient's airway patency. You also open the airways using held tilt gene lift or jaw thrust. Okay, so make sure that the airways are free. Okay, then after making sure that the airways are free, you check for breathing. Make sure that the patient is breathing well. Okay, so check for breathing. You look at the patient, all right? Look at how they are breathing. Is it in distress or normal? You listen, then you feel, all right? Then provide rescue breaths if necessary. Rescue breaths could be that you are giving mouth to mouth, or it could be that you are giving oxygen cylinder and all that, all right? Then circulation. You check for signs of circulation, like you take the pulse of the patient, you take blood pressure, all right? Then you can start chest compressions if necessary, just like this. Okay, push it, push it, push it. Make sure that your patient is what? Circulating blood adequately. Now, this ABCDF of what resuscitation, it has another arrangement, all right? But I think this is like more of old fashioned, all right? What we follow these days is the ABCDEF. Okay, so having spoken about the C now, which is circulation, let's go to the D. D is disability, to access for the patient's neurological status, and that's where you use Glasgow Coma scale, right? So you check if the patient is opening eyes on command or not. You check the power of the patient. You check the motor sensation, um, sensory sensation, and all that, right? Then you check for any possibility of any disability or injury in the patient, all right? Then exposure. Expose the patient's body, okay? And this will help you what? This will help you what? Access for injuries, okay? They provide warmth and prevent what? Hypothermia. I'm coming. Very important thing. We're actually supposed to go to the hospital by 6 o'clock, and if you look down, it's like 5:26, right? So this might be like my last video. So you provide warmth, okay, and make sure that your patient is not what? Cold. All right. Then fluids. You can administer fluids as needed, right? All those IV fluids, all right. It could be normal saline, it could be ringas, lactates, and the rest of them. It could be dextrose, okay. But the best one for resuscitation is what? Ringas lactate. Then you should monitor the fluid status and adjust as necessary. Okay, so guys, that's it um, about this ABCDEF of what? Resuscitation. Everything you need to actually do to actually what? Keep your patient in a steady state. before you start the main treatment. All right, so that's it.